My name is Melisa Bonzo. I'm connected today from Homs in Syria, but I will present a case study from Juba, South Sudan, that I managed for 2 years between 2017 and 2019. The presentation will start from a general description of the humanitarian situation in South Sudan in the frame of the COVID-19 pandemic. It will look at the ICRC response in Juba for the component of access to essential services as water supply, for which power supply is an enabler. One of the proposed solutions in this context is the construction of solar-powered water yards, and we'll look at their technical design, cost of construction, operating costs, and organization of communities for the operation and maintenance. Finally, we will hear from a water committee member, Mr. Lomi Lang, in a short interview that was recorded a few days ago on the use of solar water yards. In South Sudan, it's a country of 11 million people, out of which, according to UN OCHA figures for May 2020, 7.5 million people need humanitarian assistance. This is because of years of conflict, violence, and underdevelopment of services. According to the UNICEF WASH report for 2019, there is 41% coverage of water and 11% for sanitation nationally. In this context, COVID-19 pandemic is an emergency that could further deteriorate the humanitarian situation. Water, sanitation, and hygiene activities are one of the pillars for the humanitarian response in this complex situation, where the implementation of simple preventative measures such as self-isolation and hand washing can be a challenge. In the next slide, we speak of power supply. The ICRC in South Sudan today is responding to COVID-19 as part of its response in prisons, health facilities, IDP camps, as well as for the general population requiring access to essential services. In a context where power supply from the grid is almost non-existent, with only 1% of the population having access to electricity, none of the activities would be possible without including a solution for power supply at the onset of any response. The government of South Sudan and the African Development Bank are upgrading the power distribution system with 20,000 domestic and commercial consumers planned. Traditionally, in emergency situations, the instinct is to use generators for powering any intervention. However, with the recurring emergencies such as cholera and now with COVID-19, this approach in the long term is not sustainable. The idea of constructing off-grid water points, initially like in Yemen, started in the rural areas but is now being adopted in urban areas. In the last years, Juba City is facing unprecedented population growth, with people coming from different parts of the country and neighboring countries. The estimated population of Juba is 403,000 people, but it's probably underestimated. This increase in population exerts a lot of pressure on existing infrastructure, especially for water supply. During the cholera outbreak in 2016-2018, ICRC responded by water tracking, hand pump rehabilitation, and borehole drilling within the most affected communities in and around Juba City. After the outbreak was over, ICRC aimed for a more sustainable, medium-term solution, less dependent on fuel for power supply, to reach a higher number of people and to reduce the risk of cholera and now COVID in the future. This became more important when only 60 out of the 600 water tankers that sell water had access to fuel during this time. And so how did we manage to identify the communities where we should install solar water yards? We designed a decision-making mechanism to identify the most vulnerable communities to assist with solar water yards. This approach was supported by a detailed epidemiological study where the cases of waterborne diseases recorded in the 15 primary healthcare centers under Juba City Council were linked to a specific geographical area. This meant that the communities with the highest number of cases would be the most vulnerable and therefore they needed more assistance. We also identified the number of water facilities in all these communities in Juba and their status. Are they functioning or are they not functioning? And this is being developed into an online map. It's important to know that as of December 2019, of the 335 water points in Juba, 175 are functioning. And of these that are powered by generators, they are not functioning because the community cannot afford the fuel for the generators. In this slide, we see the different interventions presented, and it's important to note that they are complementary and they are in parallel. The short-term intervention is a mass water treatment and distribution through water tracking in an emergency, such as cholera and now possibly in COVID-19. The medium term is the construction of the off-grid solar-powered water yards, and the long term is the construction of a new water treatment plant that has the capacity to treat 500 cubic meters of water each hour. In terms of the medium and long-term solution, sustainability of operations is important, and we'll see in the next slide how solar power is key for communities to be able to organize themselves and afford the maintenance costs. In 2019, 3 boreholes drilled by the ICRC during the cholera outbreak with a yield greater than 5 cubic meters per hour were upgraded from a hand pump to a large solar water yard. The advantages of the solar water yards in comparison to the hand pumps are there's a significant increase in the number of beneficiaries. For the 3 water points I'm mentioning, they now serve approximately 15,600 people. The collection of water does not require the beneficiary to exert a lot of energy in the manual pumping from a hand pump, which normally is a very difficult task. Each of the solar water yards is connected to between 2 and 4 so-called water kiosks. Each water kiosk has 4 taps, and this allows between 8 to 16 people to collect water at the same time. The kiosks are constructed as far as 400 meters from the water tower, and this reduces the distance that people walk to collect water. The use of solar water for water yards also reduces the cost of water for the neighboring communities. This is because water tankers can fill water at the solar water yard and travel a short distance to the neighboring communities to sell the water. This and the above points are important considering that it's mostly women and children who are involved in water collection. In the next slide, you can see on your left there's a graph showing the variation of the water supply for each month of the year and then for the different hours of the day. In the months between May and August, which is the rainy season in Juba, the water supply reduces by as much as 55% because of the cloud cover. In contrast, when the community uses the generator for their water supply and they don't have any fuel, then they don't get any water from their water point. In Rumbek, South Sudan, ICRC provided a solar system to water yard serving 15,000 people because the community could not afford to pay for the water to run the generator. It's important to note that the design of the solar water yard is based on the yield of the borehole. In this instance, we have 3 designs. For a borehole with a yield between 1 and 2.6 cubic meters per hour, you will have a 10 cubic meter tank at a height of 4 meters with a maximum of 2 kiosks. For a borehole with a yield between 5 and 10 cubic meters per hour, you will have a 27 cubic meter tank at a height of 6 meters with a maximum of 4 kiosks. For a borehole with a yield greater than 10 cubic meters per hour, you will have a 48 cubic meter tank at a height of 6 meters with a maximum of 4 kiosks. The number of beneficiaries is calculated at 20 liters per person per day. This amount is based on the FAIR standards of a minimum of 15 liters per person per day. It's also based on the amount of water that can be extracted from the borehole without affecting the aquifer, and also the quantity of water that is affordable for one family in June. If we look at the costs of construction of the water yard, its main components are the water storage tank, the pump and its accessories that include the solar panel, the kiosk and the filling station, the pipeline, and the security fence. The 10 cubic meter design costs approximately $5,400. The 27 cubic meter design costs $68,100, and the 48 cubic meter design costs $76,800. What's important to note is that these costs do not include the drilling of the borehole, which is approximately $77 per meter. In terms of the operational costs, which are the next slide, the community basically decides together how much they're going to charge for the water. This is to ensure that all the community members can afford the water. On average, each family spends $1 each month on water. If I use Gudele Block 7 as a case, that has 700 families benefiting from the solar water yard, they're collecting $500 per month. Therefore, in 1 year, they will collect $6,000. So the rate of return on investment will be 11 years, 11 and a half years. However, if the management system becomes more efficient and they collect $1 from the 700 families who benefit from the solar yard, the rate of return will be reduced to 8 years. The operational costs and the level of data that is collected for each solar water yard, it varies from one community to another. The main expenses, however, are the salaries for the kiosk operators, the replacement of taps, and for communities that have a generator for the rainy season, fuel and maintenance. On average, the cost of operation without the generator and fuel is $80 per month. Generally, sustainability is one of the major challenges for construction projects in South Sudan. The main reason is the lack of financial resources, including power supply, and the absence of dedicated and qualified staff. For the ICRC assisted large solar water yards, the asset-based community development ABCD approach was implemented to tackle this challenge. The official handover of the large solar water yard marks the end of the responsibility from the ICRC to the community. We provided a 2-day training session on financial management and the technical components of operation and maintenance. Now the community members are practically learning how to manage their own water yards. According to the credo, you're responsible but not alone. The ICRC continues to monitor the development of the projects and provide support whenever needed. This includes refresher training courses and facilitating exchange between the different communities on how to manage their water yards. The good management of a water yard, of a solar-powered water yard, is an opportunity for the community. They can engage in community-led projects that are funded by the income that they generate from the money from the water that they sell. However, the main worry that we have is if the income that they generate will have the same value and if it's not eroded due to inflation. This is because the components that are likely to fail in a solar water yard, such as the pump, the control unit, and the solar panels, should be replaced after a minimum of 10 years. You're now going to watch a video on the feedback of the use of solar water yards from Gudele Block 9 in Juba, South Sudan.
The feedback from my community is positive. Most of them, they're happy. Now they are getting water in cheap price and very clean and very near to every person. In the beginning, we are getting water from stream water yard, and that water is not clean. It's dirty. It's having waterborne disease.
Especially these days in Juba, we have not recorded any cases of cholera outbreaks. Also, with the current COVID-19 pandemic, the solar-powered water yards ensure that communities have access to clean water that ensures hand hygiene. Hand hygiene is key to controlling the COVID-19 spread.
Melisa, we are back on the main screen.
Okay, thank you. So, in conclusion, we can see the benefits of the solar water energy. We can see the benefits of using solar energy for powering water yards from the video that we've just watched. There's increased access to water supply in terms of quality and quantity, the ability to promote hand hygiene for the COVID-19 response because of the availability of water, the positive social aspects that include the recognition and status of the community and its people. Looking at 2020, monitoring and evaluation will be the major component of the project. It will help us to understand what we've done well and what we can improve in the next projects. There are success stories and failures, and we should learn from both.